Okay, come Pudha.
Good afternoon.
Good afternoon. Come sit. You are, what is your number? 8910, no? Okay, I will start the question. We'll assume you are the house officer in a surgical ward. Now, 35-year-old male came with multiple stabs and he died following admission in your ward. Maybe we'll say hemorrhagic shock due to multiple stab injuries. So, what is the next procedure you do? Do you fill the declaration of death or do you do any other things?
I will not fill the declaration of death form because there are certain indications for a HO to not fill the declaration of death form and request an inquest. In this case, it seems as an unnatural death, so I will not fill the declaration of death form.
Okay. Now, you told this is unnatural death. Who will conduct the inquest in this scenario?
In this scenario, the magistrate will conduct.
Okay, we will switch the topic. Now, see this specimen here. Okay. Yes, you can see. You can see the specimen. Now, what are the important points which you can see? Turn, whatever you want. Turn. What are the important points you can see in this specimen?
This fetus is immature, that it cannot survive on alone, and the upper limb has been cut off.
Yes.
This seems to be compatible with a criminal abortion.
Yes. What can you tell about the maturity?
Maturity can be assessed by Hassay's rule and by the length of the fetus.
Any other thing?
No, don't.
That's okay.
That's okay. Okay, right. Then, what do you mean by criminal abortion?
Criminal abortion in the context of Sri Lanka would be any abortion that is performed for any other reason other than to save the life of the mother would be considered as criminal abortion.
Right. Do you know about the law?
Laws
Section
would be 303 to 307.
Okay. Can you see identify this plant?
This plant is Ricinus communis.
Prisoners communist. In the normal term, singular, what is it? Endero. Can you tell me some medical legal significance about this plant, or why do you study about this plant?
This plant can be used for abortion. Can also be used for. Can be also cause of suicide. Can be used for suicide. Also accidental deaths. So that is why we should learn about it.
Which part of the plant is the most poisonous?
The seeds.
Seeds.
Both of us has seen these photographs. What do you think about these injuries? You can take it to your hand and have a look.
These injuries seem compatible with the burn injury, madam.
Yes. So can you elaborate it more?
It's compatible with hot water.
What do you say so as hot water? Do you see any splashes or trickle marks?
No, madam.
No, then?
Then it would be compatible with a hot object placed on this patient.
So, yes, we agree. Can you think about any circumstance?
Torture would be one circumstance where this is compatible.
Reasons that you think in this line? Circumstances?
Because there are multiple hot objects placed repetitively at different sites.
Yes. And this image, this lady came to us with a complaint of assaulted by somebody else, right? So you can have a close look. What do you think? Can you agree with her, or what is your opinion?
These injury patterns seem compatible with self-inflicted. However, I cannot give a definite diagnosis in this case. I would require, if madam can give further information, then I can come to a definite diagnosis, madam.
Likewise?
Like the handedness of the individual and any other injuries present in any other parts of the body.
Yes, she is left-handed, and there was a little injury over her lower leg.
Then the injury is compatible with her history that she presented with, madam.
Right. Can you diagnose this condition?
This seems to be a subarachnoid hemorrhage matter.
Yes. And causes?
Causes, subarachnoid hemorrhage can be due to spontaneous or traumatic. Spontaneous causes would be if there is a rupture of a berry-aneurysm. Traumatic causes would be if there is due to CV1 syndrome. Again, traumatic impact to the head also can cause rupture of berry-aneurysms. Intracerebral hemorrhages which leak into the ventricles, which finally enter into the subarachnoid space, can also cause this.
Right, your time is up. Take your admission.
Thank you.
Okay.
Thank
Yeah,
you.
and then good.